She's a cardiologist and also vice president of medical affairs for Hello Heart. Dr. Morgan, always a pleasure to have you. Good morning. Hoping you can explain Good morning. Hoping you can explain a bit more about what we heard in Arlette's piece there. So when doctors say that the cancer has a Gleason score of 9, what exactly does that mean? What do you hear in this statement?
And so what I hear is they look at two different sections of the prostate, looking at the cells in those sections, and they are assigned a score. And it really depends on how well or poorly differentiated those cells are. So this is a pathologic staging. And so they look at those two, and when they add them, they can add up the score. The score goes from 1 to 9. 9 is the highest, meaning it's fairly poorly differentiated, and we can expect it to be aggressive.
And so aggressive, but also appears to be hormone sensitive, according to the statement, which allows for effective management. Dr. Morgan, what does management, or what do treatment options look like here?
And so, there has really been an explosion of treatments really in the last few years, thanks to research, and we see prostate cancer really benefiting from that. And when we talk about these androgen sensitive tumors, it wasn't long ago that we really treated these by removing the man's testicles, because what we were really trying to do is block the testosterone. Now we can do that chemically through medications, not only block the testosterone, but also then block further synthesis or the production of these androgens in this testosterone. And so it appears that that will be at least one avenue of therapy that they will pursue for President Joe Biden.
Yeah, I mean, do you have a question about he's the former president, presumably has access to the best doctors in the world. Why this wasn't caught sooner?
That's an excellent question, Rahel. And sometimes you can have normal or mid-range PSA values and then have an aggressive tumor that rapidly accelerates in the 1 year between your PSA checks. This certainly could have been what happened with the president. We certainly don't know as well if he had been monitored along those lines. Additionally, there are some forms of prostate cancer where you really don't get an elevated PSA, a prostate-specific antigen, nothing that would rise to a concern. And he also may have one of those subtypes as well.
And then what would you say the survival rate is? I mean, based on what we know, and obviously the caveat is there's a lot that we don't know, but based on what's been released so far, what's the survival rate like?
Yeah, with these bone mets, that is automatically a stage 4. We have a TNM system of staging, so tumor, nodes, metastases. These metastases to the bones automatically elevated to a stage 4. And the survival rate is generally about 5 to 7 years, maybe even moving out to 10 years, especially when we think about the availability of clinical trials. So when we look at these types of tumors, it could be that his survivability would be that he would die with it as an 82-year-old male, as opposed to dying from it. But the survivability could be as high as 7 to 10 years.
Okay. Dr. Jane Morgan, thanks for being here this morning. Thank you.
Thanks, Rahel.
All right, and Joe Biden's cancer diagnosis is being met with well wishes from those who served alongside the former